We will now continue the conversation looking at the future of Gavi, and I would like to introduce my colleague Rumbi Chakamba to the stage.
Thank you so much. I think we can all agree that was such an interesting panel. And as we make the transition, I'm just going to call some of my panelists to come on stage. I have Dr. Sania Nishtar, who is the CEO of Gavi, the Vaccine Alliance. We have stairs this way, Dr. Nishtar. And Professor Muhammad Ali Pate, who is the Coordinating Minister of Health and Social Welfare in Nigeria, as well as Javier Guzman, who is the Director of Global Health Policy at CGD. A star-studded panel that we have here, and really excited to have all of you here. So I have had the privilege of reading an opinion piece that Dr. Nishtar has just written for Devex. It's going to publish later on our site later today. And just plugging that if you guys want to get that delivered into your inbox, I suggest you sign up for Devex Newswire, which is our daily newsletter, if you haven't already. So Dr. Nishtar, it's been 2 months since you started the role as CEO of Gavi, the Vaccine Alliance. So we're really honored to have you here with us today to share some of your insights as you get into this. And in addition to the change of leadership at Gavi, you guys are also set to introduce a new strategy. I just wanted to check with you, 2 months down the line, how do you foresee Gavi changing within the next couple of years?
Well, thank you for the invitation. Thank you very much for the invitation to be on this very exciting series of interviews that you're conducting this week. Devex is a very important communication partner for us, and thank you for your question. So as you know, Gavi is currently in the process of revising its strategy. The strategy which will commence January 2026 for a 5-year period. We call it Strategy 6.0, and there are a number of important changes within that framework. And alongside, we are also kicking off a process to fundraise, which is called replenishment for the same period of time. In terms of your question of what changes we should expect, so let me share my perspective with you. As an incoming CEO, 9 weeks into the role, I see that there's a landscape where the institution has done remarkably well over the last 24 years. It has vaccinated 1 billion children, saved 17 million lives, contributed to halving child mortality. And it operates at a very low cost. It's a very efficient model. There's a clear path to sustainability. Countries graduate, 19 countries have graduated, countries co-pay. The model is also very resilient and agile. It came into play during COVID. And now, as a result of catalyzing the ecosystem, we have a number of different vaccines, about 20 vaccines. For most of them, there is no supply constraint. So for a new CEO who's grounded in country work, in developing country work, I see an organization which is fairly well running. I see 20 vaccines on the market. I see that for most of them, there's no supply constraint. But I also see the challenge. The challenge is delivering it to the last mile. The challenge is navigating health systems in countries. The challenge is reaching zero-dose children, as they call them in the Gavi parlance. These are millions of children who have never been immunized. So my focus would very much be on bringing innovations to scale to overcome the systems constraints that exist in countries. My focus would be very much on simplifying the grant-making process, making the country at the heart of decision-making, and I'm sure my brother Mohammed will have a lot to share in that respect. My focus would be on empowering the countries, respecting community voices, putting countries at the heart of decision-making, coordinating better with other global actors in the global ecosystem to support ministers like Mohammed. My focus would be very much on other than the country-facing work and execution, would also be forward-looking. What do we see 20 years, 30 years, 50 years from now in terms of the vaccination landscape and what we can actually do to catalyze changes which will enable us to bear the fruits of science and innovation in ways that empower people and in ways that save lives in the most underprivileged populations. My focus also would be on women. I'm just coming up with my 6-month plan, and one of the 5 important pillars is a focus on women, both secretariat facing, both country facing. And then, of course, my focus would be on, given that we are in an environment where conflicts, climate change, and all these fragile situations are now the norm. They are the new normal. So my focus also would be very much to position the organization to serve those situations better, and not just for conflict and climate change related matters, but also for outbreaks and epidemiological emergencies. So across these different domains, I've already initialized work, and I'll be releasing my 6-month plan soon, where areas, milestones, timelines are all articulated. So exciting time.
A very exciting time, and we're looking forward to reading that 6-month plan and digging into it. You've said a lot of things that I want to unpack in this conversation, but one thing that you keep stressing is having countries at the heart of decision making. And Professor Pate, I think you can definitely speak to that. What do you want to see from Gavi from a country perspective?
Thank you. I think I'll say we want to see a lot. That answers your question. Gavi has been one of the most successful public health partnerships we've seen in the last 25 years. The miracle of vaccine, it has been able to take it further than any other partnership that exists in terms of getting children vaccinated. A big kudos to all the excellent staff of Gavi and the new CEO that is setting up a very ambitious agenda, which we're looking forward to. But it's 25 years or so in the making. And I think many things have sort of shifted, and I think there is an opportunity to rethink the model of the alliance in terms of eligibility, in terms of transition, in terms of the country alliance functioning, the alliance functioning at the country level, how it shows up. This is not necessarily only exclusive to Gavi, but it's to global health initiatives broadly. If you are at the country level, what you see is a cacophony of global health partnerships that are fragmented. The global health landscape is hyper-fragmented. The coherence is lacking, and the transactions are multiple. So to what extent does an alliance like Gavi and others come together and actually work, make it easier, put countries at the center and reorganize backwards? Country contexts differ. One solution constructed in Geneva doesn't apply in all countries equally. So I'm very glad that the new CEO of Gavi was able to visit us, to go to the field, to see the realities in our country, and we really appreciated that visit to understand, even within a large country like Nigeria, that differences, significant differences between Sokoto, which is a very low-income country sort of context, and let's say a state like Lagos, which you can say is a middle-income country. Those differences actually matter. So really flipping the model to think of countries at the center, organizing yourselves from the global health initiatives in a way that supports country priorities, using national systems, because these are the systems that have the reach, the legitimacy, and in fact can be more sustainable, and thinking about other elements of fiscal policy that is necessary to sustain whatever it is that is introduced. Gavi has been able to reduce the cost of vaccines to make them accessible. Amazing feat. I think we need to see more of that. But when you look at the model of, okay, introduce vaccines over time, then you ease out of it. Well, you pile on these vaccines. Countries have to be able to afford them. And how do you really work as an alliance? Not necessarily just the secretariat. I'm calling out all the members of the alliance, WHO, UNICEF, World Bank, all the various parties to come together around country plans, use national systems, have some humility to understand country context and support in the delivery of vaccines. And I'm really glad that Dr. Nishtar, my sister, is working in that direction to put countries at the center of our agenda. So.
Dr. Pate really outlining there what countries would want from Gavi. And like he said, it's a lot. But also, Javier, CGD also published a policy paper, which is entitled A New Playbook for Gavi. And I think it incorporates some of the things that Professor Pate has mentioned. But what more do you want to see out of Gavi?
Thank you. Thanks for the invitation. And just wanted to say this is a crucial moment for Gavi and for other global health initiatives. And we need to recognize some trends and we need to recognize some disruptions. So in terms of the trends, I think it's important to acknowledge that the macroeconomic climate is not ideal. And it's not ideal for Gavi or for global health in general. And it's not ideal for countries. So domestic financing is also difficult. And that has to be part of the conversation. The second thing in terms of the trends is something that we've heard. I mean, we all recognize the importance of localizing. And localizing implies decision-making by countries, implies regional manufacturing, implies changing the model of decisions in Geneva, and that's just not going to be easy. And last but not least, in terms of the trends, Dr. Pate mentioned the importance of the future in terms of reducing fragmentation. So if we think about 2030 and the Sustainable Development Goals, there needs to be a new playbook in terms of what's the future going to be like. It cannot be vertical. It needs to be integrated. And the future of global health initiatives, the implementation of the Lusaka agenda, I mean, that's all going to be part of the conversation as part of the replenishment and the new strategic period. But I want to also mention 3 disruptions that are very important in terms of the status quo. First is, Dr. Nishtar said, zero-dose children. Those children that have never been immunized are actually increasingly in middle-income countries, the countries that are no longer eligible under Gavi. So that is a very big issue. I mean, discussing about eligibility and discussing about middle-income countries and how to reach those children. The second is conflict and fragility is no longer an anomaly. It's actually the norm. Nearly 50% of the countries eligible currently under Gavi are classified as fragile or in conflict. So the same model that Gavi has applied in the past is not going to work in the future for those countries. And this is very important. And last but not least, this is something positive. We see a lot of interesting good vaccines in the pipeline. We're now talking about TB. We're not talking about 2 malaria vaccines. And that basically means, well, of course, promise, but also challenges. So I'll stop there. Thank you.
So much to unpack, Dr. Nishtar. I think we've got 100 million questions from you coming from there. First of all, I want to talk about the current climate. Javier is talking about finances and how they are constrained. In addition to that, we talk about conflict settings, how this is the new norm. And then we also go into eligibility and how so many of the children that you want to target are in countries that are not eligible for Gavi support. So do you see all these things being incorporated in Gavi 6.0 in the new strategy? And how are you working to sort of counter some of these challenges that both Dr. Pate and Javier have highlighted?
Well, I think both Mohammed and Javier make very important points. As far as the middle-income countries is concerned, and the middle-income country have a specific definition in Gavi. These are countries who fall above the eligibility threshold, but are still below another threshold. And these are either never Gavi, or these are former Gavi countries that have graduated. But these are countries where averages are hiding a lot of inequities, let's put it that way. So and some of these are very large countries where majority of the zero-dose children sit. There are also some countries who are on the path to graduation, either in the preparatory phase or in the accelerated phase. And Nigeria is a case in point, where averages, again, hide a lot of inequities and where there are pockets where a lot of zero-dose children sit. And Mohammed took me to Sokoto in the north of Nigeria, which presents one such illustration. So a long-winded way of saying, yes, this definition of mix is very much within the purview of 6.0. And there are specific policy levers which will allow us to be responsive to these pockets. Also, triangulating mix with fragile contexts, and I completely agree with you, this is now the new norm. These are not these isolated pockets that sit here and there. So again, there will be flexibilities and tailored approaches allowing us to respond to these situations. And the other thing you talked about, your first comment was about what country empowerment means. And you very rightly said that country empowerment is not just, it should not be notional. You have to back it with a concrete set of norms and principles and execution mechanisms that truly localize decision making, that have to do with attention to domestic capability to co-finance, that has to do with empowerment of regional manufacturing. And I couldn't agree with you more. And I can tell you that both Strategy 6.0, as well as my set of priorities articulated for the 6 months, will be grounded in these realities. We have no other option from a model standpoint, from a practical standpoint, but to empower countries. That is the only way to make things happen. And in order to do that, there are 2 sets of imperatives. The first imperative is for us as global health entities. We need to coordinate better. I think this is the 4th panel that I'm going to over the last 48 hours, where I'm saying the same thing again, which is to draw back on my experience as a minister of social protection, where the largest department I had was the department that coordinated with all the donors, the multilaterals and the bilaterals, different reporting lines, different procurement systems, different asks, different frameworks. And for a significant period of the time, I used to be following those. We need to change that. The donors need to, the donor partners need to act with one line of support. And there's a lot of convergence that has to happen between us, between Gavi and the Global Fund to begin with, which is something I'm taking very seriously. But then also, and I think Mohammed will understand that because he is a federal minister in a large federating country. So he will know exactly when I say that country empowerment also has to do with an in-country agenda. Because a lot of times, external agencies feel constrained because the federal government doesn't want to pass powers to the provincial or the state government, and the state government is not relinquishing control in favor of the local governments. So if we really have to meaningfully, if we're really and meaningfully interested in impacting the poor woman at the last mile, the poor child at the last mile, if we're really and genuinely interested in their welfare and their well-being, we have to do things differently. You might want to call it a playbook. I might want to call it something else, but we have to do things differently. We have to coordinate better at the global level and let go of our egos and turf issues and controls and budget pockets and think in the interest of people on the ground. And then, of course, the country has to do likewise. So I don't want us to think that the problem lies at the global level only. I think the countries also have to get their act together. A lot of countries will not will not localize power, money, and resources, which is where that needs to happen. So there's a change that has to happen in both directions.
Thank you so much. I want to talk a little bit more about country ownership with you, Professor Pate. But before I get into that, one thing that was brought up, and Javier, you mentioned this, is this regional and global balance in vaccine manufacturing and procurement. To both of you, Professor Pate and Javier, and I'll start with you, Professor Pate. what role do you see Gavi playing in changing this landscape?
An important role, because beyond the funding, the grant finance, the vaccines that it supplies, an important role that Gavi does is the market shaping the vaccine industry. And it can use that to decentralize manufacturing capacity, and it is already doing that with AVMA. We just hope that it will go further than financing vaccines that are filled and finished in the continent, but that the real manufacturing begins to take hold. And there are other things in the back end in terms of regulatory capacity, talent building, other support that either Gavi as an alliance or other partners that have a shared understanding of this challenge will help countries decentralize the capability to produce high quality vaccines. That will be an important shift that we'll be looking forward to seeing. If you want me to talk about the country ownership, I can also go on that path. I think building on what Sania also mentioned, those of us from poorer countries, yes, we're poor, but we also have sovereignty. And we want that sovereignty to be respected. And we want the lines of accountability to be shifted in a way that is sort of much more balanced, so that the prioritization, the choices that are not made on our behalf above us, but with us and responding to us and our needs, and be held accountable as well. That is a major shift that needs to happen if we look at where we are after 25 years of the Global Health Initiative. I think that's something that will just buttress this idea of country ownership that respects the sovereignty, the sovereign decisions of countries, and puts a locus of accountability on the people that are being served, not only those who are providing the resources. Yes, we appreciate, but at the same time, that sovereignty of countries has to be respected.
So I have a follow-up question to that, which is a $1 million question, I think, but I'll come back to you, Professor Pate. You might know what I want to ask. But I'm going to jump to you, Javier. When we're talking about this vaccine manufacturing, what role do you see Gavi playing in that?
You know, as Mohammed said, AFMA is, a 1 billion advanced market commitment to incentivize manufacturing. But I've got two things to say on that. The first thing is, unfortunately, Gavi cannot limit itself to just financing because it will fail. And therefore, that basically means leading a coalition of the willing to make this enabling environment a success. And that's not going to be easy. If you look at regulation, for instance, out of the 14 countries where you've got manufacturing projects now, only 2 are actually eligible for pre-qualification. 12 are not eligible for pre-qualification. Basically, that means that if the requirement is to have a pre-qualified product, only 2 out of the 14 are able to get that. So you need to work on alternative pathways. You need to work on regulation. You need to work on enabling environment. And I'm not even talking about, last mile delivery. So that's the first thing. So coalition of the willing. But the second thing is we see Gavi, of course, leading on what they know, but we see how the landscape is very fragmented and is very uncoordinated. A lot of people are actually investing into local manufacturing without actually agreeing how this should be done and agreeing on a coordinated effort. I think that's key for this window of opportunity to materialize, because we should not fool ourselves. We've been here before. This conversation about local manufacturing and increasing resilience and increasing is coming from the past. Of course, COVID was a wake-up call, but we cannot go ahead without really seizing the window of opportunity.
Thank you so much. That's really important to highlight, especially at time with WHA 77 and the talks that we just had about the pandemic treaty and how we are a little bit stalled to remember this is a window of opportunity. But Dr. Pate, I want to go back to you because I'll be remiss to let you come off this panel without asking this question. So you talked about country sovereignty, and I think from all the conversations that I've listened to, or all the things that I've read about things that you've said, you talk a lot about country ownership and working within the national health systems that already exist and how important that is. And you're in a unique position for this panel because you were announced the CEO of Gavi and you decided to take on the role in Nigeria. May I ask why is that, and is this linked? Is this linked to this call for a sort of a focus on like a national plan?
I think it was to give way to a better CEO to Gavi. So, and Gavi has a fantastic CEO. I think Gavi has a fantastic CEO, so I'm really glad that we can work with her as well. I think it's, at the end of the day, for countries, I don't think the ownership, the respect will be granted to us by default. We also have to work to earn it. So going back to Nigeria, in a way, it's in Gavi's interest because we account for a large part of Gavi's challenges, large part of many of the global health challenges. And we see that if we can get that sorted out with the president's focus on health and within the continent of Africa, I think it will make a big difference in terms of the balance and our ability to negotiate on the global stage. So I think it was a great opportunity to go back and continue doing the work that I think is important even for Gavi. That's why we're very glad that Sania visited us immediately she started, and we look forward to a very strong partnership with Gavi in the years ahead. Yeah.
I think that's really important to highlight that there's work that's needed on both sides. And we're coming to the last 3 minutes of this panel. And I think one thing that we all agree on is that there's a need for things to change. It's a new environment. Gavi's done well so far, but there's a need for things to change. So in the last few minutes, I just want to get a few takeaways from each one of you. What do you want people to walk out of this room with? Javier, I'll start with you.
I think I would say this is a very important moment, and Gavi should treat this strategic period as a period of experimentation. From now to 2030, what are the changes that will need to be scaled up after 2030? Because we understand this cannot be changed overnight, but you need to put in place the mechanisms and the pilots and the changes that you will want to see in a big way after 2030. So I would finish with treating 6.0 as a period of experimentation where you can actually move on this big agenda of reform.
Thank you so much. Looking ahead, and Professor Pate, what would you like people to walk out of this room with?
Shift your locus of decision making more towards countries. I think that's going to be very important. Adapt to our context, respect our sovereignty. I think organize better, show up more coherently, build national systems that are more sustainable, go deeper on the delivery. So several asks we do have them. Yeah.
Thank you so much. And Dr. Nishtar?
Well, rather than summary points, I've got 1 minute 55 seconds, and I thought I would use this time to perhaps connect back to the sovereignty piece that Mohammed talked about. I couldn't agree with him more, and perhaps clarify a few points with regard to regional manufacturing that has been mentioned several times. So Gavi is launching what is called the African Vaccine Manufacturing Accelerator. The official launch is on June the 20th in Paris. But we need to be clear on what it will take to move towards the goal of vaccine sovereignty for Africa. It's a goal that we should all pursue, but we have to be very clear on what the path is to achieve that goal. And on that path, Gavi is one of the several players. I do not want anyone to believe that we have a magic wand and this is something that is totally within our purview, because it is not. We are one of the enablers. We may have come forward as a catalyst with a bargaining chip as a catalyst to say, yes, when everything gets up and running, we will underwrite with a subsidy of 1 billion when it comes to procurements, and we are signaling it to the market that yes, this will work at our end, but our role is just to is just one in a very long chain. So 20 seconds to go. I want to explain what that chain is. Well, first of all, manufacturers, and there are some manufacturers in the room, have to set up the plants. And in order to set up those plants, there are a different things that come into play. Foremost, government's policy. I mean, where do interest rates stand, for instance? That's nowhere in the conversation. I mean, a market actor is going to look at an enabling policy environment, and interest rates are going to factor into that in a major way. What is the government's policy on manufacturers? Are they going to give any subsidy? Are they going to give any tax breaks? What is the government's overall policy environment like? Does that country have chemical industry? Will they be sovereign when they're just doing fill and finish? And when there's no chemical industry or capacity to produce active APIs on the continent? And are the countries willing to share active APIs or not? So that's another consideration. What about the regulatory capacity? What about the human resource? What about diagnostics and lab capacity? Because from our experience in other countries, we know that it takes decades to build that capacity. Once, of course, the plants are there, then the question of demand comes in. So if you have plants already in Africa, and if African governments are still procuring from the West, then that defeats the purpose. So getting the plants up and running, getting them to produce quality products, getting them to get them pre-qualified from their, getting them passed from their own regulatory agencies, getting the vaccines PQ'd by WHO, then pulling in the demand, then for them to compete in tenders, and that's when our role comes in. So I do not want anyone to think that Gavi has the money to put into the plants, or that we are the ones who will do everything in the country. We have a defined role, or we will play it very well. We've already set aside the money. We have already gotten the initiative approved from our governing bodies. We have, in fact, July the 6th, our governing body will be approving the final structure of AVMA. The money is in the bank. We are ready to come in, but the manufacturing capacity has to be set up. The vaccine has to be PQ'd. They have to compete in tenders, and governments within Africa have to have an appetite to procure from their own plants, and that is how this ecosystem will work.
Thank you so much, Dr. Nishtar. And Professor Pate, I know you want to respond to that, so I'll give you 1 minute. I'll give you 1 minute.
2 seconds. I will say this, the old model, the way things have happened over the last 20 years. But there are things that are shifting. Technology for vaccine manufacturing is shifting from biologicals to chemistry. And we can leapfrog. And for Gavi, the question is whether it's the old or whether it's willing to go with the new. Because so long as Gavi goes on the path of a concentrated supply from 1 or 2 areas, traditionally, it may begin to lose countries as they become more prosperous and the vaccine manufacturing capabilities are decentralized. They'll find a way. So that's a very pivotal moment, and an ecosystem approach is needed, and governments need to rise up to do what they need to do. And that's why in the case of Nigeria and also the Africa region is really intently looking at that, because the world before COVID was certainly not working very well for us. And we don't want to rebuild that world. What does the new world look like? And so the litany of things that we have to do, that's traditional. But I think we're keen to look at how we can disrupt that. And we've seen that in other regions, how that has been disrupted. So we're not the first regions to diversify our manufacturing capacity. So I think it's a big question for us at the country level, but also for the global health ecosystem and actors. Are we going to be held back to be coming back to Geneva for our vaccines? Or are we going to have a system whereby the global pools can buy from us and develop with us as well as part of this global commons in preparation for whatever it is that comes next in the pandemic? Thank you.
Thank you so much. We have unfortunately run out of time. I had more questions, and I'm sure our audience had more questions as well. But we will continue this conversation. Please sign up for Devex CheckUp. This is one of the topics that we follow quite closely. Thank you so much.